Well, I have no disclosures on my paper. And today we're going to talk about the ultrasonographic and high-resolution anal manometry assessment of pelvic floor structural abnormalities in female patients with chronic functional constipation refractory to medical treatment. As we all know, chronic constipation is one of the most common chief complaints in the general practice. And this problem affects between 2 to 34% of adult population. And pelvic floor dyssynergia is a well-known cause and a prevalent cause of functional constipation. And some of the patients that we get to see in our multidisciplinary clinic, we work as coloproctologists and urogynecologists, have already tried every first-line treatment, like laxatives, change in lifestyles, and high fiber. So the objective of our paper was the assessment of pelvic floor structural abnormalities in patients with functional constipation throughout transperineal echodefecography and high-definition manometry. And we tried to correlate these findings with the presence or the absence of dyssynergictification. The study was a single-center study, a retrospective trial, and the inclusion criteria were all female patients with diagnosis of chronic functional constipation refractory to medical treatment, as I said before. And this protocol for chronic constipation is the one that we have in our clinic. We always have a proctologic and gynecologic clinical evaluation of all the patients. And we use this questionnaire, the CAS questionnaire. We also do a high-resolution manometry and the transperineal echodefecography. And the questionnaire that we use is this one, is the CAS score, and it consists of 11 questions. The first question is the duration of the symptoms of the complaints. 4 questions are about symptoms of defecatory obstruction. 2 questions are about frequency and consistency of bowel movements. 2 questions are of facilitating maneuvers, and 2 questions are about gastrointestinal symptoms. And this is a self-applicated questionnaire. And based on the results of this questionnaire, we can see if the patient has slow colonic transit, obstructive defecation disorder, or a mixed pathology. And we use it as an initial assessment tool for constipation classification. For the statistics, for the quantitative variables, we reported means and standard deviations. And for the qualitative variables, frequencies and percentages. For the variable comparison, we use the test student test. And for dichotomous variables, we analyze with the chi-square test. The risks were established throughout radio, and the p-value was significant when it was less than 0.05. As the results of our study, we had 40 female patients. The mean age was 52 years. 10% of our patients had a history of hysterectomy, and 60% of all of patients analyzed had dyssynergictification in the high-resolution anal manometry. 95 of the patients had an anorectal structural abnormality, and in the transperineal defecography. And these abnormalities were, the main ones were rectocele in the 37%, rectocele and cystocele in 15%, and cystocele in 10%. And the mean score of the CAS questionnaire was 19 points out of 39. That's the most a patient can get. And we tried to reclassify the CAS, the patients that had less than 16 points and more than 16 points, and we found that more than 16 points represented a risk factor for presenting the dyssynergic defecation, with a sensitivity of 68.5% and a specificity of 100%. Positive predictive value of 100% and negative predictive value of 31.3%. And 91.7% of these patients with dyssynergictification had an anatomy anorectal structural abnormality, documented through the transperineal ultrasonography. And as conclusions, we found that more than half of the patients with chronic constipation, functional constipation, refractory to medical treatment, had dyssynergic defecation. And that pelvic floor structural abnormality was a common finding in our series. And the CAS score questionnaire can aid us to identify these in the first interview and also in the general practitioners, so we can implement maybe different treatment options like biofeedback earlier on. And that's all for my paper.
Do we have questions for the paper? So I have a question for you.
Okay.
So were the women in your study, were they recruited from specialist clinics or from primary care?
No, from the specialist clinics.
From the specialist clinics. How long had they had chronic constipation for?
Well, most of the patients had like more than 6 months.
Yeah. Okay.
Already treated.
Already treated, and that included laxatives?
Not biofeedback. Laxatives,
okay. Laxatives,
diet, and fiber.
Okay, good. Thank you.
Thank you.
Would like to ask, thank you for a nice presentation. I would like to ask, if you go out and ask healthy women, how common is it with rectocele and cystocele?
If I ask
healthy women without problems, how common is it with rectocele and cystocele?
well, I think in Mexico it's a very common problem because most women have several vaginal deliveries. And I don't know, I guess more than 30% of women over 30 years old have pelvic floor dysfunction that includes prolapse of pelvic organs.
Yeah, okay, thank you.
Great. Thank you very much.